Good evening, everyone. I am trying to get my picture up here so that I can see myself. Um, Welcome to Regis College, the President's Lecture Series on Health. If you're here to attend the panel on environmental trends at the forefront, essential knowledge for U.S. healthcare practitioners and the public, you are in the right place. I am Penny Glenn, and most of you probably know me by now. I am the coordinator for the President's Lecture Series on Health. And tonight I'm pleased to let you know that over 85 people registered for this particular panel, and we'll see how many actually attend. But for those of you who are here, I think you're going to find it a very, very enjoyable evening. We are incredibly fortunate to have four prestigious speakers, two of whom we have invited back because they were so well received in April of 2019. Each speaker is knowledgeable on tonight's subject matter in very different ways. And the one thing that crosses the board is that they're all incredibly committed to their work. Tonight, we're going to address the role of climate change and health outcomes. When the committee decided on this topic, believe it or not, the devastation of Hurricane Helene had not yet occurred, nor were the wildfires raging in New York and New Jersey. Today, actually, on FEMA's website, you can register for assistance from 22 natural disasters over the course of this year. You can register for the support that you need. 22, and I bet many of you didn't realize it was that many. It's natural disasters from Alaska floods to New Mexico's wildfires to the 2 episodes of severe storms in Vermont, which were just 2 weeks apart. These climate disasters have severe consequences, as many of you know, including short-term, medium-term, and long-term, all of which you're going to hear about tonight. As you will see, each of our speakers will present on the topic from their own unique perspective. But before I introduce the panelists, as you know, I do have a few housekeeping items that I have to attend to for the purposes of the CEUs. And then I will introduce our panelists. First to receive, oh, no, now I've got to share my screen. If you'll hold on a moment, and I'll put this up. And I will make it slideshow from the beginning. Okay, so as I said, I'm the coordinator for this series. And now I can begin the important things that are required by the ANA. First, to receive contact hours, you must stay for the entire presentation until the end, which includes the question and answer period. At the end of the Q&A, you can click on the link for the evaluation form in the chat. And that link will be there until 8:45. So you need to copy it if you're not going to fill it out immediately. The link, however, is only good until 10 p.m. So you do need to fill it out. Include your name and, if needed, the name of your faculty if you are a student looking for credit in class. Okay, let me make sure. All right. What to expect and when. CEU certificates will be, and you'll be amazed at how many people don't remember this, but CEU certificates will be emailed to the RNs in 7 to 10 business days. If you don't have it by 10 business days, then you need to email the President's Lecture Series. Students don't receive evidence of having attended. Rather, your faculty will get a list of the students who attended the entire event. If you are not requesting contact hours or class credit, we hope that you will still fill out the evaluation because we really appreciate your feedback and use it. Okay? And then a few quick meeting reminders while you're in the meeting. All attendees have been muted, and we ask that you remain muted throughout the lecture with your video turned off. At any time during the program, you may submit questions directly to everyone in the chat. And it's interesting, sometimes when you submit those questions, it will prompt other people to think of questions, and those help us in the end because we will answer them to the best of our ability. During the Q&A period, we will look at all those questions, and I'll be directing them to the individual speakers to the best of my ability, hoping that I'm choosing the right speaker, and if not, they'll let me know. During the last 10 minutes of the Q&A, you also may raise your hand and speak in person if you so choose. I don't believe in the, I think it's been 7 years of doing this that I've had anyone do that, but it would be nice if you did that. So now I'll introduce tonight's panelists, and I know sometimes this can be tedious, but these individuals, as I read, what's online about them or their resumes, and I realize that, oh my Lord, they were going to school while they were working, and they've worked so hard and done so much that it's really important to share it. So hang in there with me. Our first speaker is Dr. Keith Sider. He's a very distinguished meteorologist who has spoken to us before in 2019. He's been in the field for well over 30 plus years and is currently a visiting professor at the College of the Holy Cross and Executive Director Emeritus and Senior Policy Fellow of the American Meteorological Society, where he was first employed in 1999. So that tells you how much experience he's bringing. He knew what he, unlike many of us, and certainly unlike myself, he knew what he wanted to focus on in his career right from the very beginning. And I didn't mean to do that. So he knew what to focus on in the very beginning, given that he earned his undergraduate degree in meteorology at Pennsylvania State University, and then his doctorate in geophysical sciences at the University of Chicago. He has also had a postdoctoral appointment at the Air Force Geophysical Laboratory in Hanscom Air Force Base before moving to the University of Lowell, where he taught as well. And that was before he went to the society. He is a fellow in the Royal Meteorological Society and a member of many other societies and organizations in the sciences and scholarly publishing. He obviously has published, he serves on a number of advisory boards, and today his research interests include, and this is really important and why he's here, include investigating how the government, private, including NGOs and academic sectors, can cooperate and collaborate to better address climate change and its expression through impactful weather events. And he wants to change it toward a society that is more resilient and sustainable. And it is this interest that brings him here tonight and this evening to present his overview of the climate change in the United States. Our second speaker for the evening is Lindsay Butler, who also spoke in 2019. She did not have her doctorate at that time and has in the meantime earned it. She's an environmental epidemiologist and sustainability leader, specializing in the intersection of climate change and health. She too, as I said, has spoken before. What it's important is she's currently the VP of Sustainability Solutions at CREF Global, which is interesting. And there she helps manage complex real estate portfolios in healthcare and higher education in ways that are cost efficient, sustainable, and most important, human health centered. She's also a faculty lecturer at UMass Boston, where she teaches Environmental Studies 101, which is amazing because she also considers this an honor. I'm not so sure I would, but she does. Her recent work is dedicated to the decarbonization and climate resilience of large health systems. By now, you're probably wondering why she's speaking on climate and health tonight. Well, like Dr. Sider, it is clear she knew what she wanted to do from the very beginning. Her BS from Simmons University was in environmental sciences, and her PhD is in environmental health. She's speaking tonight because prior to CREF, she served as the first ever Director of Climate and Health Resilience at Blue Cross Blue Shield, Massachusetts, which is a feat in and of itself when you consider how large that organization is. And I'm now trying to get to my next page. At Blue Cross Blue Shield, she was committed to carbon neutral and zero waste by 2030. And she developed their first ever environmental justice community grant program. She was also the Deputy Chief of Policy for the City of Boston during the passage of the Building Emissions Reduction and Disclosure Ordinance. She describes herself as an environmental optimist. I think you can tell from her picture, she looks like an optimist. She is dedicated to harnessing the power of the private sector to advance climate action and protect human health. She views sustainability programs as a strategic business advantage and not as a cost center. She's also speaking here tonight because she has a passion for science communication. So she's communicating to our audience tonight, but she believes that communication can't start early enough. And so she's currently penning a series of children's books on solutions to the climate crisis. Our third speaker is William Harlan, or Bill, currently Vice President of Behavioral Health and Health Engagement at Point 32 Health. He is probably the second speaker to ever speak from Harvard Pilgrim Health, which has sponsored this series for its entire existence. Point 32 Health is a leading not-for-profit health services organization comprised of a family of companies providing a range of services from primary care, health insurance to home care. Each of the companies, what's unique about them is they're committed to equity in health and healthcare, as is Bill Harlan. Bill Harlan has extensive work experience in mental health and the healthcare industry. He knows and understands behavioral health from a variety of roles, from that of clinician to operations manager to the director of clinical programs and strategy at Point 32 Health, to his current position as VP for behavioral health and health engagement at Point 32 Health. Previously, he held roles at Beacon Health Options, including Vice President of Operations and Assistant Vice President of Operations. Before doing all this, he was, I want to skip because you've got way too much here for the operations management that he did. He did do he's also a clinician, which is very important to this presentation. He did his clinical work in mental health at Germain Lawrence, where he provided clinical care, individual, group, and family therapy to adolescents and their families within a diagnostic residential setting. And he did outpatient therapy at Philadelphia's Mental Health Center. So you can see that he has gone from the fundamental mental health delivery of care to patients, all the way up to being VP of mental health programs, etc. So he has his Bachelor of Arts in Psychology and a master's degree in counseling from Temple University. And finally, our fourth speaker tonight is Tim Cronin with his master's in public administration. He's Associate Director of Policy and Advocacy for the Climate and Health Program at Healthcare Without Harm, a company I had never heard of and am very glad to know about. Healthcare Without Harm is an international governmental organization that, and I quote, seeks to transform healthcare worldwide so that it reduces its environmental impact, becomes a community anchor for sustainability, and a leader in the global movement for environmental health and justice. In his current position, he manages a portfolio of federal and national scope policy projects and initiatives to advance climate smart and health equity practices within the U.S. healthcare sector. His focuses include state and federal Medicaid and Medicare policy, Inflation Reduction Act implementation, the Department of Energy, and the Environmental Protection Agency. Prior to this position, he was Massachusetts Director of State Climate Policy, and he led them. He's also a member of the Healthcare Without Harm Climate Policy Team, and according to its website, in collaboration with the Clinton Global Initiative, Healthcare Without Harm is committed to doubling the number of healthcare institutions around the world working to achieve net zero while enhancing climate resilience. Thus, Tim will address the issue of the role of healthcare itself in climate change and the importance of policy and advocacy. Okay, so now if I can do this correctly, I will, and I'm looking for polls. Where did they go? Maybe I will stop. Let me stop my share and go back here. Polls and quizzes. Climate change. Can people see that?
No. Oh, yeah, it just popped up.
Okay, so this is the poll, and I will make it large. And what I'd really like, this is really a poll to see where you as an audience are in relation to climate change. And I tried to make the questions non-threatening. There's no right or wrong. Well, there in some of them, there is a right or wrong answer. But if you could just go ahead and answer these questions, it would be great. And I'll give you about 3 minutes. And the more people who take it, the more we'll have a sense of the audience as a whole. And I think I've got about everybody who's going to answer this. I guess we're pretty lucky that we got 28 to 29 people, and I'll quickly go through these just so you see where you are. And so that the speakers, the panelists can see, all right? So are you aware that because of, oh, I better put my glasses on. Are you aware that because of carbon emissions, the sea level in Boston could rise by 6 to 18 inches by 2050 if we don't do something about it? And yes is the correct answer. And what, 76% of you knew that, and 24% did not. So you're going to learn more about that tonight. In the United States, severe storms, this was surprising to me, in 2023 resulted in a little more than 500 billion in costs. And 85% of you said this was true, and it is. And 15% of you will learn more about that tonight. And this, I think, as I read it, was a trick question. Severe heat waves are an equal opportunity health threat. All right. 83% of you said this was true. And in fact, it's not. And you will really learn about the social determinants of health and the who gets exposed to different things and at what level. Are you aware that Massachusetts has at least 29 community behavioral health centers that are one-stop shops for a wide range of mental health and substance abuse services and treatment? And 63% of you said no, and I would be in that percent as well. I had no clue we had that type of service available, and it's of paramount importance when you have these disasters. To date, have you engaged in a climate protection intervention other than recycling, using solar heat, reducing electricity usage, or driving an electric car? And 36% of you have, and 64% of you have not. And I hope by the time you end this evening, you will have a much better sense of what else you can do. So that is it. And now I will close that and stop sharing my screen. And I will turn it over to Keith Sider. Dr. Sider, are you there?
I am indeed.
Oh, good.
And so let me share my screen. There you go. Well, it's nice to be here with all of you, and I appreciate this opportunity to speak to this event again for the second time. It's been really nice to have this opportunity, as I say, to share some of the things that I care about and that I would like all of you to understand better. My role tonight is really to set the stage for some of the discussions we will have later and really talk about the causes of climate change and some of the more significant impacts, including some that are not as closely related to health as some others actually are. Let me begin by just saying a little bit about when we say climate, what do we mean? And there certainly is, it's important for us to sort of keep the distinction between climate and weather. Climate represents a statistical description of the atmosphere, ocean, land, and cryosphere system. Typically, we do this over multiple decades and look at averages and the variability of different whether it's temperature or precipitation or some other variable that we're worrying about. And that statistical description is the climate, which is separate from what we see from day to day, which is what we refer to as the weather. Our global climate is determined by an energy balance between the energy we're getting from the sun and how our system of the Earth and atmosphere system interact with that energy. It is strongly dependent on the chemical makeup of the atmosphere itself. And if that atmospheric chemistry changes, if we change the constituents of our atmosphere, that impacts that energy balance, and we will end up changing our climate. The graph that you see on the right here is a graph of observations of carbon dioxide from the late 1950s up until just a year or so ago. And it shows that we have been increasing the amount of carbon dioxide in our atmosphere very dramatically. I won't go into the science behind this, but we know that all of this increase is due to humans. There is no question that it's humans that are causing this increase, and it has been significant, and it impacts our climate because this is one of the constituent gases that impacts the way that radiative balance is attuned within our atmosphere. And this is a sort of a cartoon diagram of what the greenhouse effect looks like. This is the greenhouse effect is what we call that balance system, that energy balance system between the Earth, atmosphere, and sun. And in the greenhouse effect, we get our energy from the sun. It warms the Earth. That warmth radiates back out towards space. But within our atmosphere, we have a series of gases that are called greenhouse gases that intercept some of that warmth that's coming from the surface, warm the atmosphere, and then that warmer atmosphere radiates some of that heat back to the surface and makes the surface warmer than it would be otherwise. This difference is significant. we would be a mostly ice surfaced planet without the greenhouse effect taking place within our atmosphere. Our average temperature over the entire surface of the globe is on the order of 50 or so degrees Fahrenheit. It would be 0 degrees as an average over the entire Earth if we did not have the greenhouse effect. So the greenhouse effect is something that's very good in terms of making the Earth livable for us. But by increasing the amount of carbon dioxide and methane and a few other gases in our atmosphere, we are making the greenhouse effect stronger than it would be otherwise. And so we're actually increasing the temperature of the surface of the Earth because the greenhouse effect has become more effective as we have added carbon dioxide into our atmosphere. And we see that pretty clearly. If you look at the temperature record over the last 170 years, this goes from 1850 up until this year, you see very clear evidence that the Earth is getting warmer. It is pretty undeniable that we are a warmer planet than we were 100 years ago. And it is now undeniable that humans are the cause for this warming. It is just, there's just no other explanation for what we see going on here. And this temperature difference right now, we are at a point where we are about 1.5 degrees Celsius warmer than pre-industrial times. And that again, that warmth is completely due to humans. And it's due to our adding carbon dioxide and methane and a few other gases in our atmosphere to levels that are different than they would have been naturally. And that is almost completely a result of us using fossil fuels. So most of the warming is due to carbon dioxide, and that carbon dioxide that we're adding to the atmosphere is coming from our burning of fossil fuels, oil, coal, and gas. That's what's causing the warmth that we are seeing in the atmosphere and in the entire Earth system. And it's not just the atmosphere that we're warming. The atmosphere is the one part of this system that we see most readily in terms of our experience. But the oceans are also getting warmer. This is a similar kind of graph from 1880 to a couple of years ago, showing the average global sea surface temperature. And you see it is seeing that same warming trend that we're seeing in the atmosphere. And it also has gone up by a number something like a little over 1 degree Celsius. That's an enormous amount of energy because it takes a lot more energy to warm the ocean by 1 degree than it does to warm the atmosphere by 1 degree because water has a much higher heat content. And so this really represents a big change in the energy balance of our Earth system. And we're seeing this in pretty much everything that we see, every observation we take and that we do over multiple years, we see this warming signature, which is due to human activities. Before we get into some of the more health-related things, I wanted to just say a little bit about what one of the biggest impacts of our warming Earth is going to be, or is already being, and that is the increase in sea levels. Oops, went the wrong way. There we go. This is a graph with a projection for the future for the sea level in the Boston area. As the Earth gets warmer, there are two things that happen. One is we're melting ice that has been on land surface for so many years, so the glaciers are melting, and that water, that additional water, is making its way into the oceans. And also because the oceans themselves are getting warmer, the thermal expansion of that water ends up having the sea level rise. So both of those effects are related to our warmer Earth, and both of them are contributing to having sea levels go up over time. Our sea level in the Boston area has gone up about 10 inches in the last 100 years. It is projected to go up considerably more than that, with the wide range of projections here partly dependent on what we do as a society. If we are able to control our emissions of greenhouse gases, reduce our use of fossil fuels, become very aggressive at getting back to a situation where we're not putting so many greenhouse gases in the atmosphere, then the amount of increase of sea level may be limited to another foot or so. If we are less successful in those efforts, by the end of this century, we may be looking at 6 or 7 feet higher sea levels. That's a pretty big range, but it's also a kind of a pretty scary prospect, and that's why I wanted to mention this. This is probably the largest challenge that we are facing with global warming. Any coastal city, and this is an image of Boston, but every coastal city was built with the notion that sea level was pretty constant, that sea level was not something that would change over time. So there's an entire built infrastructure that is right at the water's edge that is pretty close to sea level. And if you raise sea levels, then you impact these coastal cities pretty dramatically. This is an image of what Boston would look like with sea levels 6 feet higher than current levels. And what you see is that much of downtown Boston, with the exception sort of of Beacon Hill, would be underwater at that point. Clearly, we are going to have to take actions as a society to keep this from happening in our coastal cities, and that is going to be very expensive and very disruptive. And just to give you a sense of the scale of this effort, um, worldwide, over 200 million people live within 3 feet of sea level. Many of those people live in countries that are much poorer than ours, that are much less able to adjust and adapt to these rising sea levels. And so we're really looking at a worldwide catastrophe that's sort of happening in slow motion here as sea levels continue to rise and impact communities near the coast. Even in the US, however, we have many cities that are very vulnerable to sea level rise, and it's going to be a huge undertaking to try to protect these neighborhoods that are close to the coast or move people away from vulnerable neighborhoods. Both of those things represent very expensive activities. So this is going to be a tough one for us to deal with. So going back to this picture of how temperatures have been changing over time, let's talk a little bit about some of the issues and some of the ways that this expresses itself. And what we see as weather, our day-to-day variability of weather, really represents an expression of our climate. And so as the climate changes, we see those changes by changes in our weather. And so these differences on a global scale that may only be a degree or a degree and a half, and I say only sort of in quotes because that's still a very big number as a global average. But these things that may not feel like they're a very big change when you just say the number of a degree, that is expressed through our weather in ways that that actually are very noticeable and that we see very significant impacts from. And what we're doing as a globe is we are shifting our averages towards warmer averages. And when you do that, what you're doing is you're shifting things in ways that have a much larger fraction of our weather events be ones that take place when the weather is very warm. And since many of our severe weather kinds of phenomena depend on heat as one of its energy sources, as we move to a warmer Earth, we are seeing more severe weather in lots of different ways. And some of these have very direct health impacts, and some of these have much more subtle impacts. I'm going to just hit a couple of them because some of our other speakers will hit other components of this. But let me just give you sort of a taste of how this changing climate is changing what we are seeing and what we're already seeing, not looking decades from now in a changing climate, but even right now, we're seeing some of these impacts pretty dramatically. And here's an easy way to get a sense that the world is very different than it used to be. And this gets to one of the questions that you just answered. This is the number of billion-dollar disasters in the United States for the last 43 years. This has already been adjusted for inflation. So these are constant dollars across inflationary increases, but it gives you a sense that we are living in a world that's very, very different than it was a few decades ago, where we are seeing severe weather impacts that are much, much more significant than what we had been seeing, as I say, just a few decades ago. Very hard to have anything but a sense that severe weather and weather-related impacts have become dominating in terms of sort of the things that we are dealing with as a country. And 2023 was a particularly bad year with close to $600 billion worth of damage coming from weather events. And most of these coming from severe storms, which is the green color portion of each bar there. So very big impacts already. This graph will keep getting larger and larger. These bars will keep getting larger and larger as the Earth continues to warm, because as I said, most of the weather events that represent severe weather are fueled by the energy that comes from higher temperatures. Looking at temperatures themselves, this is a kind of a neat little cartoon graphic that shows the difference between a few decades ago and where we're headed as our Earth gets warmer. The blue kind of pillar at each one of these cities is the average number of days over 95 degrees during the month of July in the 80s and 90s. And the red pillar is what we expect to see happening by the time we get to 2050. And so you can see that for these eastern cities in New England and the eastern seaboard, we are looking at many more days of 95 plus than we used to have, even, as I say, just a couple of decades ago. You all saw in the news the kind of things that were happening in the southwestern part of the United States with these incredible high temperatures happening day after day after day. Phoenix went for 113 days straight with high temperatures above 100 degrees. And temperatures on the range of 110 or higher were not at all unusual during that string. And the low temperatures were also very, very warm, so that people were not able to get relief even at night by having the temperatures go down significantly. So when you are looking at temperatures that are well over 100 degrees during the heat of the day and that don't abate overnight, it's very hard for people to get relief, and you have heat impacts that come into that situation pretty quickly. And heat is a real killer. This is a graph that shows weather-related fatalities, and we tend to think of things like hurricanes and tornadoes as the things that kill lots of people, and certainly they do, and certainly we worry about that. But year after year, the largest source of fatalities for weather-related events is heat. And so that's why we spend so much time worrying about heat, and that's why even just having a small number of days that get above 95, or certainly they get above 100, where our body's capacity to cool itself becomes greatly diminished, those situations are much, much more dangerous from a public health point of view. We also have seen a lot happening in terms of wildfires, even here in the Northeast, which this is not something that we're used to seeing every year, but this year we're seeing this kind of activity. We know this is bad for the environment. The portions that get burned, of course, those are areas that are destroyed. We see houses that have been completely obliterated as part of these fires. We also see the health impacts from air quality from the smoke coming from these hot fires. And fires are happening more frequently. The wildfire season in some areas has become the entire year rather than just a few months each year. All of these things are part of what we would expect to see happening as the earth gets warmer, as we start having more drought conditions in some areas, as we're able to have situations where we can dry out the fuel that feeds these fires, because of the higher temperatures, being able to have enhanced evaporation and dry out those the ground clutter around trees and those sorts of things. In some cases, the increase in the amount of fires is not just due to climate change. In many cases, we are using land less effectively or less efficiently than we used to. We are not taking care of some of our wooded areas as well as we need to from sort of a forest management point of view. And so some of the increase in the amount of wildfires is due to human changes or human activities separate from the fact that the earth is getting warmer. But when you combine those two together, you end up having a much more serious situation. And so, this graph shows that even without climate change, the number of acres burned by wildfires would be going up because of human activities in the way we manage our forests, in the way we're building around them, and in other things that we're doing to make wildfires more prevalent. But when you add climate change on top of that, you start seeing very much more dramatic increases in the amount of wildfires being produced and in the acreage that's being burned by those wildfires. So there's sort of a kind of a double impact here of humans causing this to become much, much worse, both from their activities separate from climate change, but also because of what we're doing that's causing the earth to get warmer. And so I'll kind of wrap up here and just with something. This is a sequence of images showing Hurricane Helene as it moved into the Florida Panhandle and then up along the eastern seaboard. You all know the kind of impacts that we saw from that. There were the direct impacts of the storm surge in the Florida coastline that killed many people. The wind damage, the storm surge damage, all those things were very serious impacts from Hurricane Helene. We also then got a lot of inland flooding from this hurricane. And so you've all seen pictures of the things that were happening in Georgia and South Carolina, North Carolina, Eastern Tennessee, all of these areas, especially the mountainous areas where we had this severe flooding and again, many people dying in flash flood incidents. This is another example of the way the earth is changing as it gets warmer. Helene grew over the Gulf of Mexico water, which was the warmest it has ever been. And so this hurricane had energy that it was able to tap into that was much more significant than hurricanes had 20 or 30 or 40 years ago. So that made this a more intense storm than it would have been otherwise. And as a warmer atmosphere can hold more water, this storm brought with it more moisture. And so as it moved inland and we started having the rain from this being sort of squeezed out of the storm as it moved into the higher terrain of the eastern seaboard states, there was more water there. And so the flooding was much worse than it would have been if the atmosphere wasn't as warm as it was for this particular storm. So all of those things are examples of as the earth gets warmer and the oceans get warmer, events that have always been true. We've always had hurricanes, we've always had floods, but those things are getting worse. The hurricanes are getting more severe, they're intensifying more rapidly, they're bringing with them more rain, so that when they move inland, we're having much heavier flooding associated with them than we ever used to in the past. So all of these things contribute to the kinds of billion-dollar disasters that we saw, the impacts of trying to keep people safe and keep people healthy and sort of protect the lives and livelihoods of the population of the United States. So we're dealing with a different world than some of us grew up in. And it's a world that we need to understand better, and we need to be prepared to make changes in what we're doing to try to have this not become an even more serious situation for us. So with that, I will leave this discussion. There are many, many other things we could talk about that are the ways our warming Earth is expressing itself through weather events. But let's move on and talk some more about the health issues. So with that, let me turn it over to Lindsay.
Thank you so much, Keith. I really appreciate it. That was an excellent overview of the ways in which our atmospheric conditions are changing. And now I'm going to talk a little bit about what that means for human health and double click on some of the illnesses and adverse outcomes that we know are changing and increasing as a result of climate change. So let me just share my screen now as well. Okay. All right, so what you see here, this is an image from the Centers for Disease Control, and I want to draw your attention to sort of the center of this diagram where we see some of the things that Keith just discussed. We know we are dealing with rising temperatures. We know those rising temperatures are a result of our rising carbon dioxide levels that are occurring because of human activities like the burning of fossil fuels. Naturally, our Earth is supposed to have carbon sinks and carbon sources. And as a result of land use change and the burning of fossil fuels, we have taken parts of the Earth that should be absorbing carbon dioxide, and we have turned those into a carbon source. So we know we have those rising CO2 levels. We know we have rising temperatures. As Keith said, those rising temperatures are leading to more extreme weather events and rising sea levels. Ocean water is getting very, very warm. Actually, the ocean absorbs 90% of the excess heat that is generated by climate change from human causes. And this excess heat is energy that is making those storms much, much stronger. In addition to those strong storms, we also have shifting precipitation patterns, right? Because as he said, the carbon dioxide heavy atmosphere can hold more precipitation. And we're also having extended periods of drought, like we're having right now in New England. And we're having sea level rise as a result of that warmer ocean taking up more space, but also the melting of the Arctic glaciers. And as a result of all of that, we're having these things like extreme heat, severe weather, increased air pollution, changes in vector ecology, which I'll discuss further, increasing allergens, increasing sort of potency of allergens, as well as increasing intensity and length of the allergy season. We see water quality impacts, and we see far too much heat-related illness and death. We see forced migration from parts of the world that are experiencing some of these very severe conditions. And I know that we're going to hear a lot about the mental health impacts tonight as well. So, as Penny said, my training is in environmental epidemiology, and as environmental epidemiologists, we want to connect an exposure disease pathway. We want to know how a characteristic of an environment is creating hazard that is leading to an adverse health outcome. So here's just a simple breakdown of what that pathway looks like for these climate change related exposures that are creating adverse health events. So we know what's happening. We know we're having things like warmer temperatures, increase in wildfires, changing precipitation patterns, much stronger storms. We know this is resulting in direct hazards such as extreme heat, fire and smoke, extreme weather events like drought and extreme hurricane. And then we see health outcomes like heat stress, vector-borne illness, allergies and asthma, injury that could come from severe storm, for example, displacement of populations, and also mental illness. So I want to talk a little bit about heat stress first. As you saw from that image, when we look at the causes of death across these different natural disasters, it is heat stress that is by far the most deadly. I remember when I was a graduate student, we conducted a survey of a subsample of Boston's population, and we asked them, which of these extreme events scares you or frightens you the most? And we gave them selections that ranged from extreme flooding, extreme blizzards, wildfires, droughts, a heat wave. And we were really surprised to see, as epidemiologists, that really no one that we surveyed chose heat as the thing that scared them. And we were surprised because as epidemiologists, we know that's actually by far the most deadly natural disaster. So extreme heat is conclusively linked with a lot of increase of risk of illness and death, particularly in vulnerable populations like the elderly, young children, and pregnant women, who are all groups that, for various physiologic and metabolic reasons, might have a difficult time regulating their body temperature in the face of rising heat. And we've seen analyses in the epidemiologic literature that's looked at hospital admissions and ER visits on hot days. And there is a widely accepted literature now that has found that increase in heat and hot days is leading to increase in heat stroke, cardiovascular and respiratory complications, renal failure, electrolyte imbalance, kidney stones, and fetal stress and preterm birth. I actually did my PhD dissertation on the impacts of climate change on the health of vulnerable populations. And one of those populations that I looked at was pregnant moms. And what we found was that across the United States, as the ambient outdoor temperature rose, there was an increased risk in both preterm birth and stillbirth. And a lot of people think that this increase in adverse health outcomes with rising heat is at more extreme temperatures, right? Keith showed that in the southwestern part of the United States, we're clocking temperatures of 120 degrees, 121 degrees Fahrenheit. But actually, the threshold for when we start seeing this increase in adverse health events is a little bit lower than you would think. This analysis that was conducted in 2019 by Vaidyanathan et al. Found that the threshold for that, starting to notice that increase in these heat-related illnesses by looking at heat hospitalizations, it starts in the Northeast region at just 86 degrees. And we have some climate projections that say by the 2070s, 2080s, Boston could be having upwards of 50 days a year over 90 degrees, that our climate could be more similar to what we now see in Birmingham, Alabama, than what we're accustomed to in Boston. So the threshold for these heat-related illnesses is kind of low, and that's very much cause for concern. And I also want to point out that these relationships between heat stress and adverse health events and the way our populations experience heat stress is not an equal opportunity health threat, as Penny said. There's a lot of inequity in the way populations experience heat stress, and that has a lot to do with their built environment. This is a snippet from the Boston Globe in 2020, which is saying communities of color hit hardest by heat waves. Like COVID-19, severe heat waves are not an equal opportunity health threat. The most disinvested neighborhoods, those dominated by buildings, pavements, and parking lots, are hit the hardest. That's because of something called the urban heat island effect. If you think about how you experience heat on a really hot summer day, would you rather be in an area where there's a ton of trees, a ton of green space, a ton of natural shade, maybe by the coast, Or would you like to be in the center of downtown Boston with high rises and a ton of impervious surface and asphalt and not a lot of trees and green space? You want to be surrounded by those trees and green space because that helps absorb that heat and helps us to cool down. Whereas when you don't have that investment in trees and green space and open spaces, that heat is just radiating. Boston has one of the worst urban heat islands. In one study, it said that it was the #5 worst heat island in the United States because we have a great deal of disparity across our neighborhoods in green space. And I want to talk a little bit more about the roots of that disparity in green space. I always show this image here on the left, and I ask my students if they know what that image represents, that map of the Boston area with 4 different categories: green, yellow, blue, and red. And for any of you on the call who work on social determinants of health, I'm sure that you know what those maps are. Those are redlining maps. So redlining was a practice following 1930s era New Deal policies that allowed for families to get access to a federal mortgage loan program. And the creators of the program created this sort of grading strategy where they called neighborhoods desirable to sort of semi-desirable all the way down to hazardous. And that was the score of if somebody was going to be able to access that mortgage program. So you're more likely to be able to take advantage of this federal mortgage program if you lived in a desirable neighborhood versus sort of semi-desirable down to very hazardous. And it turns out that those categories were assigned for pretty much one reason, and that was the number of people of color and immigrants living in that part of Boston. So the reason I sort of talk about this in the context of extreme heat and health inequity is when you look at, I hope you all can see my cursor. I'm going to orient you by the map. So if you look at this area, which is actually around sort of the Castle Island into South Boston, into the sort of Dorchester, Roxbury area, and you look at sort of this large section of the city that had been redlined. So this is an area where it was very difficult to get access to a mortgage because there were more people of color living there. So this was a very inherently racist policy. And then I want to draw your attention to this map over here on the right. And this is the daytime land surface temperatures in Boston, where the red areas indicate parts of Boston where you have much hotter temperatures on a hot day. And I want you to look at the similarity of these two and how these redlined neighborhoods where we have chronic disinvestment because we had low levels of home ownership and we weren't investing in preserving green space and planting trees in those areas. Now those are the hottest parts of the city. And now those areas are being more impacted by extreme heat and the health impacts that come with it. So I'll now transition to another sort of group of illnesses that we know are being impacted by climate change, and that's vector-borne illness. Vector-borne illness is illnesses that are carried to us through some pest, some pesky rodent or insect, or could be a bird. These are transmitted to us through rodents and parasites and mosquitoes. And so these diseases transmitted to us through insect bites, things like Lyme disease from ticks, Triple E, West Nile, and Zika. These are all going to be on the rise. When we think about the ways in which our conditions are changing because of climate change, it's getting hotter and it's getting wetter in many places. And no one loves more heat and more moisture than the most deadly animal on the planet. And I also pose this question to my students. I always ask them, what is the most deadly animal on the planet? And they will say, oh, Dr. B, it's obviously the sharks. Or they will think of some predator like a tiger or a lion. the most deadly animal on the planet by far is the mosquito because of its ability to transmit deadly diseases to us. So when no one loves more moisture and more heat like a mosquito. So we are creating an environment that these mosquitoes are going to be so happy in, and they're going to be spreading in their range. They're going to be living in a longer season. Rising temperatures are increasing the length of the mosquito and tick season. Increasing rainfall, right? That warmer, that CO2, high CO2 atmosphere that's holding more precipitation, that increased rainfall as a result of that is making a much more viable mosquito environment. And this means that the geographic areas where these vectors can thrive are expanding a great deal. If you think back to the height of Zika in the United States, where pregnant women in the Boston area, say, were told, do not travel south of Georgia, because Zika has been identified in mosquitoes everywhere in the United States, so in the southeast, south of Georgia. And obviously, we all know that those mosquitoes were carrying Zika. Zika was being linked to microcephaly. So imagine as the climate is changing north of Georgia, that type of mosquito can now thrive north of Georgia, and we have an increased risk of an illness like Zika. We also have found issues this past summer with a long mosquito season, and we had fatalities in New England from illnesses like Triple E and West Nile. This is a really interesting image, I think. This comes from Climate Central. And what this is showing you is how deer tick habitat is projected to change as our climate is changing. So you can see, 2005, where the image begins, where we have deer tick viable habitat versus where we are projected to have deer ticks by 2080. Obviously, that means a much wider geographic area where we're going to see patients with tick-borne illnesses like like Lyme disease. Transitioning now to allergies. So many of us experience seasonal allergies. Seasonal allergies impact about 30% of the world's human population, and climate change is going to impact allergies in a few different ways. In this warming climate, allergy season is going to start earlier, it's going to last longer, and it's actually going to produce more pollen. Again, that pesky high CO2 is going to allow more pollen to be produced. Many pollen-producing plants like this high CO2 atmosphere. There have been a number of studies that have looked at the effects of carbon dioxide concentrations on ragweed, for example, and show that with increased CO2, plants actually produce ragweed with more irritation-causing protein. Here's an example of when we look at carbon dioxide levels. So this is actually a fairly outdated image. This is based on a study that was published in 2014. And the reason I want to tell you that this is outdated is because it refers to current carbon dioxide levels of about 400 parts per million. We're actually closer to about 450 parts per million now in 2024. So this is just an example of how climate change will increase grass pollen production. In lab-based studies where they expose plants to higher levels of carbon dioxide, they see them increasing pollen production. So if we continue on this terrible trajectory that we are on, where we continue to produce more and more carbon dioxide, and if we get to a level upwards of 800 parts per million, which is scary to even think about, we are going to see a huge increase in pollen. Another example of this is that more carbon dioxide means bigger and more potent poison ivy. Again, lab-based studies where plants are grown under different levels of carbon dioxide have shown that as you increase the level of carbon dioxide the plant is exposed to, poison ivy producing more toxic oils, loving that excess CO2. Transitioning now to asthma. So we know that one of the things we're dealing with, especially post some of these extreme natural disasters like we see in Florida, some of these hurricanes, extreme floods, is that flooding leads to mold. And we know that mold is a very dangerous exacerbator of asthma. Also, increasing allergen intensity increases allergy-related asthma ER hospitalizations. The same fossil fuel emissions contributing to climate change, right? The same things that are coming from the combustion of fossil fuels, things like particulate matter, black carbon, NOx, all of these air pollutants, they're increasing the prevalence of asthma and respiratory conditions. Higher temperatures leads to more ground level ozone, which is a very dangerous respiratory irritant, and increasing wildfire intensity, frequency, and duration impacts asthma and other sensitive respiratory conditions. I think this is a really powerful image to help us understand exactly what it's like for the human body to be breathing wildfire smoke. So this image was created right after the Camp wildfires in Northern California, and it looks at what the air quality index, the AQI, what it was during the time after the wildfire, and compared that to an AQI that would align with number of equivalent cigarettes smoked per day. And you can see that around major cities, around San Francisco, Sacramento, Stockton, up here close to where the wildfire was burning, you see these dark purple dots. These were extremely hazardous air quality index levels, upwards of 500 on the AQI. 500 on the AQI would be equivalent to smoking 25 cigarettes per day. And that was air that people with asthma were breathing, the elderly was breathing, prenatal women in their prenatal period, pregnant women at all phases of their pregnancies were breathing that, children were breathing that, asthmatic children were breathing that, infants were breathing that air. So it's very dangerous. And it's, one of the challenges of teaching about climate change now and conducting these opportunities for climate communication is, as I'm saying this, we are being impacted by this stuff in real time. We're in an extreme period of drought right now in New England. We're having wildfires in Massachusetts right now that are burning as I speak. Right now, the Blue Hills Reservation, there's a 40-acre brush fire there as a result of how dry it has been. And many of you might live in communities around the Blue Hills Reservation that are experiencing breathing wildfire smoke as I'm speaking, which is just kind of crazy to think about. This is where we are in our sort of trajectory of climate and health. So lastly, I just want to talk about the impact that these extreme events can have on our healthcare infrastructure. I know there's a lot of active clinicians and health professionals on the call. So I want to just talk a little bit about what has happened to our healthcare infrastructure in the face of some of these extreme events that are becoming more and more common. So we remember back to Superstorm Sandy, where we were very fortunate in the Boston area that by the time that storm came our way, it was low tide, which made a real difference for us. But Superstorm Sandy did a real number on New York City. At Bellevue Hospital, they lost power, including to their elevators. Generators were on the 13th floor, and they relied on a human chain to move buckets of fuel up the stairs. They had to evacuate 736 patients, closing for the first time since 1736. At NYU Langone, 15 million gallons of water flooded the hospital. The flooded ER resulted in closure. They lost millions of dollars in MRI equipment and the entire use of their elevator shaft. So for those of you who work in an inpatient setting, think about what it would be like if you don't have an elevator shaft, if there's no fuel in the hospital, and if you, in an extreme weather event, are working on evacuating over 700 patients. Here's a quote from the deputy executive director at Bellevue, who said, "I asked how much fuel we had. we calculated on a napkin that we had an hour's worth of fuel in the generator. After that, the entire hospital would go dark. And luckily, I guess a little bit of silver lining is that after events like this is really changing healthcare in that storm resilience is now becoming a much more pressing issue, and we're seeing a huge shift towards resilience and preparedness across the healthcare system. That one was Superstorm Sandy was obviously an extreme storm, but also with these extreme wildfires, we see threats to healthcare infrastructure. This was a quote from a surgical nurse during the Paradise wildfire, who said, "We packed them, patients, in every vehicle possible, newborn babies, and a lot of elderly in the community. One of the doctors that eventually escaped had to finish the surgery and get that patient out too. The bottoms of our shoes were melting." That fire moved extremely fast, and they were not prepared for how quickly they had to evacuate the healthcare system. This is an image from the Associated Press that shows the evacuation of patients in California during wildfire. You can see the haze, you can see everyone in the N95 masks, and you can see that these are really vulnerable elderly patients that are being evacuated in these emergencies. Lastly, I just want to talk about Hurricane Maria. Over 3,000 people died in Hurricane Maria, but it wasn't actually during the period when the storm was making landfall. It was actually in the days and weeks following the hurricane's landfall. And that's because of just the complete collapse of infrastructure. Most of these deaths have been attributed to the inability of the healthcare system to recover from the effects of the storm. They had no electricity, they had no dialysis, they had no access to medications that require cooling, like insulin. They had no ambulances because there was absolutely no way to get over the roads, limited to no mobility, couldn't move patients in an emergency. You think of a pregnant mom who may have gone into a preterm labor as a result of the stressful situation, and they had no ambulances and no NICU. These are the types of deaths that occurred during Hurricane Maria. So I just want to introduce some of the ways in which these climate change conditions are impacting mental health before I turn it over to our next speaker, who's really going to double click on this. But there's kind of two ways in which this stuff is interacting with mental health. One is sort of more direct. People who are suffering from PTSD, from these extreme events, for example, you see an increase in depression and anxiety in those populations. There was a big increase in depression and anxiety following hurricanes that occurred in the New Orleans area. That's been very well documented. Also, extreme heat is associated with increase in high-risk behaviors like drug use. You can even see in some of the literature an increase in uptick of crime during periods of extreme heat. And then a little bit more indirectly, this issue of eco-anxiety becoming more and more prevalent in young people, sort of fear of what is to come as a result of the changing climate, fear of storms, fear of these sort of apocalyptic wildfires, fear of drought, fear of worrying about your family as we have to inhabit an earth that has more and more extreme and uninhabitable conditions. So with that, I'll turn it over to our next speaker, who can speak more about the issue of mental health and climate change.
Thanks, Lindsay. Such good information. And as I'm listening to you, I'm thinking of my own mental health needs and needing to take some breaths as we go through. So I don't know if anyone is with me on that. You can put a thumbs up in the chat if so. Let me just get my screen going here and we can get started. So while I pull this up, just want to quickly just say hello. I'm Bill Harlan. I am Vice President of Behavioral Health. And let me swap this. There we go. Vice President of Behavioral Health and Health Engagement at Point 32 Health. I'm also a licensed mental health counselor. So I am a mental health expert, I don't claim to be a climate change expert, so I'm humbled to be on this panel with really, really deep knowledge colleagues that are doing such amazing work. And I hope to talk a little bit about what that individual impact that Lindsay was touching on as part of the overall health impact. Mental health care is health care. We feel very strongly that when we're talking about the health impacts of climate change, that mental health is in that conversation and thinking about how we can make an impact so that we can have services available. And we'll talk a little bit about how we could see looking at our system of care to be ready to expand a growing number of mental health concerns related to climate change, but also related to other pieces that are just happening in the world we're living in. So, of course, certainly recognizing that we know global warming is multifaceted and is having a lot of different impacts on different parts of our economy and society. And so the impacts of the mental health area certainly can exacerbate existing mental health conditions as one key factor. We also see it leading to new ones, and we see after weather events and after changing landscapes that we're seeing a bigger prevalence of mental health conditions arise. And we'll talk a bit about its effect after extreme weather and really what that trauma reaction looks like for folks and what that can look like more specifically and how that can manifest in different ways. And we see in short-term and long-term areas where that can go. We also see that temperature change has an impact on individuals with mental illness, particularly individuals that might be on psychotropic medications, where those medications can have individuals be more susceptible to heat and heat changes, particularly, and what that looks like within different groups. So first, kind of honing in on the mental health conditions we see after a natural disaster, as we heard others have talked about through here. What you're certainly going to hear about is trauma response. So PTSD, acute stress. Folks may be familiar with this, but if not, these are really that trauma reactions to having lived through a severe trauma and having symptoms that may include looking at reoccurring intrusive thoughts, nightmares, flashbacks of that trauma, and certainly changes in mood and thoughts related to that. We see a mixture of—
Excuse me, Bill?
Yes.
Did you mean to share your slides?
Yes, am I not sharing them? I'm so sorry. Did I not hit the screen the right way?
Yeah, just you need, okay, now there you
Does
are.
that show
Oh,
now?
see, there you are.
There we go. You can just pretend everything else was just as nice there. But,
Thank you, Keith.
thank you for the flag. Thought I hit the button. I was rivaling in my eco anxiety, but which we'll talk more through. So as we talk through, so what this looks like with trauma responses, combination of both acute stress disorder and PTSDs are going to be most prevalent. There's a wide range. Some studies show that after a natural event, the range of prevalence of PTSD is anywhere between 20 and 40%. We can talk a little bit about what that manifests like. Acute stress disorder is more of that short-term response where that can manifest immediately after the traumatic event and sometimes will dissipate, but other times can kind of move into PTSD. PTSD is a much longer term condition where there's related symptoms to the trauma that was experienced. But also related into that are anxiety and depression. So again, consistent and persistent feelings of sadness, loss of pleasure, and activities that normally do. And in some cases, severe thoughts of death and suicide. We also see an increase in substance use after a natural disaster, often as a ways for people to cope with what's occurred, but also as a rising risk for those with already pre-existing substance use conditions. And there are factors that increase this risk. And so this is why we're going to see differences in different communities and as different experiences occur. Certainly, of course, if basic needs are not met, food and shelter, we're going to see an increased risk of mental health conditions exacerbate as some daily as some basic needs are not there. Direct and secondary exposure to trauma and the type, and I'll just kind of pause on the secondary exposure to trauma. What we mean when we say that is particularly for family members and also with helping professionals, nurses, doctors, anyone in a helping profession, folks that might be on this call tonight. There is a very real phenomenon of having secondary exposure to trauma through working with others that have gone through these lived experiences and thinking about the mental health supports for the helpers has been an area certainly that's been rising, particularly after the COVID pandemic, but also after helping those after we've had so many more severe weather events and other natural disasters. Pre-existing mental health conditions, of course, and then also limited access to mental health care. And we'll talk more about access to care really as being our biggest opportunity to think through. And just as kind of Lindsay set up perfectly, one of the areas that we've observed when we look at mental health impacts on natural disasters, there's a lot of studies after Hurricane Katrina, which in 2005, one of the most deadly and destructive natural disasters in our nation's history. I used to live in New Orleans. I personally knew people that were impacted, and certainly a time where we hadn't seen really an event like this. And unfortunately, there's been more and more events similar since then. But what we're finding, and we're looking at studies, when we look at the survivors of Hurricane Katrina, we're seeing SMI or serious mental illness symptoms essentially double after Hurricane Katrina. And from that population, about a third to a half were specifically symptoms of PTSD that we were seeing in one study. And another one of kids, a similar effect, and looking at a study with displaced children and returning children back to home, about 54% were in need of further mental health care, mostly seen in kids that may have had previous trauma or previous loss. So again, kind of an exacerbation of existing or previous mental health pieces. These events can really kind of add more fuel to the fire. And long-term effects, in one study, 12 years later, working with survivors, 1 in 6 still continue to show symptoms of PTSD. So really kind of helps illustrate for us just one event that we know has similar impacts as we keep experiencing, unfortunately, major event after major event, that these are the types of reactions that we're expecting to see. And also that we also know is that this does not happen equitably. And we know that there are different impacts in different communities and in different ethnic groups and within different areas that are more vulnerable already to the impacts of global warming. And so when we look at some of those impact groups, some of the more specific areas, kids and adolescents really rise to the top as an area of increased risk. We're seeing just an overall more anxiety and depression and behavioral concerns than we've really seen in any previous generation. Lots of contributing factors to that, but we are certainly in a different era where we know there are more needs for kids for behavioral health than we've seen prior to that. And we'll talk also in a little bit, but as previous speakers mentioned, this fear for the future and a sense in looking at optimism has certainly shifted over time. We also know that vulnerability to heat stress in the elderly and higher impacts to displacement and social isolation can also impact mental health of older adults, and also seeing increased rises of anxiety and depression in lower income communities and communities of color, certainly having a disproportional access to mental health care, which can be a barrier, which is so critical right after events can occur. Having quick and timely access to mental health care can really be a predictor in long-term success. So we heard a little bit about this term earlier, eco-anxiety, while not formally recognized as a clinical diagnosis, eco-anxiety is valid, and it's an increasingly common emotional experience that really any of us or anyone who is living in today's world can experience, regardless if you had a direct experience or not, which many of us could say have had direct experiences in different stages. So really just characterized by an intense worry, fear, and distress in the future state that impacts our environment. Certainly a higher population in younger people. One survey that was done of 10,000 young people, 60% report feeling very worried about climate change and said it negatively impacted their daily lives. In another survey, 10% of those respondents reporting feeling anxious or on edge at least several days per week. And as clinicians, when we hear about these thoughts persisting over time, is when we kind of are looking into needing some additional support, especially when it's for weeks over and over. But some of those characteristics can certainly look like a worry or a fear, of course, about the environmental areas. Sadness and grief, particularly around changes to one's home, and sort of this idea of the solastalgia that is really kind of speaking to changes in a person's home that they're still currently living in, and kind of that mourning for the home that has changed. We're seeing more sadness related to that area, certainly in courses of anger and frustration, either at a perception of those responsible or at inaction of others, shame or guilt, perhaps about yourself or one's own actions, feelings of helplessness and hopelessness, especially as you think about just the sheer magnitude of the problem at hand and what you yourself can make a difference on. And so all of these pieces kind of pull together, kind of move into an area that we're seeing more people present into the mental health area with these as presenting concerns, which is not something that we've experienced prior as a presenting issue into care. So all of this is happening, and really you can't talk about mental health care in 2024 and not talk about the current crisis that we are also having in mental health, which is an access to care concern. We have seen a significant uprise in adults and children reporting mental health concerns. Between 21 and 22, 23% of adults, according to NIMH, are experienced a mental illness. That's 60 million Americans. We're also seeing that one of the fuels to this concern is that we're seeing this higher demand with a lower supply of resources for people to access. One report out of JAMA noted that 38% of people seeking mental health care, 38% increase in people seeking health care went up after the pandemic, which certainly was a shift for the mental health community in terms of new consumers entering the mental health market. But we're also having reports that the United States is facing shortages of mental health providers, particularly in rural and underserved communities. This is my shameless plug, particularly as we have students out there tonight. If you're not so sure, you're thinking about mental health or doing something in mental health, this is a great time. We need you. We are needing more people out there to work with those who are vulnerable and needing support. Drivers of this demand, certainly the pandemic, this current social unrest and the trauma related to social unrest is a particular part of it. We're also seeing a reduction in stigma. It's not completely gone yet, but we are seeing, particularly in younger populations, that acceptance of mental health concerns and openness about mental health conditions as being part of the healthcare spectrum, just like going to your PCP, seeing a therapist is less of a taboo than it may have been generations ago, which we also believe is increasing demand. But what is true is that 90%, at least in one survey that was done with Kaiser and CNN, 90% of those that responded believe that we're in a mental health crisis today, and a third did not feel like they could access the services that they need. So just a little bit to talk about what are the services that are available and access to care, what options do people have as they try to navigate the mental health system. We could spend a whole other time really talking about this. Is really at a glance sort of how we think about the spectrum of care, really ranging all the way from sort of a health prevention area, wellness area, rising risk, and all the way to acute care needs. Outpatient treatment continues to be a primary area where we see digital solutions and coaching is what has emerged recently. We have new technology that hasn't been available prior. Data is still coming in to help us better understand how we can use this technology. Coaching and peer support, there is some really good data showing that certified peers, certified coaches, particularly in substance use, have a greater impact of connecting with members and making some difference. At Point 32 Health, we employ 3 certified peers. They have a 80% engagement rate when they outreach somebody versus a 40% engagement rate from a clinical social worker. So, you know, the field, I think, is changing and adapting to how we can engage and reach people in a different way. That's been really something that we've tried to think through as well. Certainly inpatient and partial programs exist. Access to these levels of care, particularly in crisis, is a concern where we want to make sure we're thinking about how we can address access. So areas of opportunity that we see in general, there's lots of different, and this is not a all-inclusive list, but the pieces that are top of mind as we think about how can our system of care really wrap around people who are seeing more mental illness, what we can do there. Adding more providers into the field certainly is the top of mind priority, is looking through how we can make a difference there. Increasing community-based programming in CMHCs, which we'll talk about in a second. Continuing to promote whole person care, and again, another talk for another time, but the more we can connect the dots between the mental health providers and our physical health providers and our really our system of care, trying to get these professionals to sing from the same hymnal in terms of what care plans can look like. And when you go to your PCP's office and you're doing your check-ins and they're checking your vitals, checking also your vitals on your overall wellness, and looking at GAD's, assessments for anxiety and depression are going to be becoming more standard as we go through here. Continuing to do outreach and using data that we can leverage for helping to identify at-risk populations so that we can do proactive outreach. That's really kind of the area for mental health that we see like is the untapped opportunity for us to do more community outreach and get to people at rising risk before it's too late. And then also looking at our digital options and continuing to evaluate their effectiveness there, and adding support for consumers and patients who are needing help navigating the system. The American healthcare system is a very hard thing to navigate. Just do a quick overview. One thing we're doing at Point 32 Health that we implemented last year, it's a program that if you're one of our members and you need to find a therapist, you give us a call. We can get you connected with an in-network therapist. We've had 100% success rate since this went live. Telehealth options are certainly helping with that for those who have access in person, and we can find usually it's about a 5-day turnaround time. In-person appointments, we've averaged about 8 days to find an appointment, which has been a real success for the team working through it. Really, this is a program that is as simple as giving us a call, getting referred. One of the members of the team opens up a case and works end to end, does the legwork, does the scheduling, finds the therapist with the specialty that you're looking for, and closes the loop to find that appointment. Access to care is such a urgent and important piece right now. So this is one small way that we're working in conjunction with our providers to get people connected quicker. Just before I wrap, I just want to talk a little bit about resources that exist, particularly if yourself or loved ones or anybody you're working with in your professional fields. 3 things just should be aware of, for you should just know. 988 National Suicide Help Lifeline implemented huge success that we've been able to see, connects into crisis centers across the country. Also want to just put a plug in for the Massachusetts Behavioral Helpline. This was stood up over a year ago. Masshelpline.com. You can chat, you can call, you can text. They will get you connected, similar to the program I talked a little bit about, but regardless of who your insurance carrier is or any of that, they will get you connected into care and work with you to find a solution. If it's substance use, individual therapy, more intensive support, they are there to help. CBHCs, an initiative that the state of Massachusetts was successful in launching over a year ago, has really made a huge dent in making sure we can get appointments for people who need them. CBHCs, as they're also called, it's a one-stop shop. They can really take a wide range. You can think of it as the urgent care center, just like we have urgent care centers for medical. It's an urgent care center for behavioral health. And lastly, just as you're as you're hearing all of this news and this information, to think about sort of the things that you can do to just encourage everyone just to think about how they can help champion behavioral health in your world. Want to just plug in for mental health first aid. There's lots of information that exists, just like you become first aid trained for, like when I was a Boy Scout, I had a merit badge in first aid. Maybe they'll make a mental health first aid merit badge someday. But educate yourself in how you can learn some of those skills, and then be an effective support for somebody who needs validation of their emotions and their experiences. Continuing to fight mental health stigma, and also just encourage you to get involved with organizations like NAMI, National Alliance on Mental Illness, for continued advocacy. Thank you guys for letting us talk, and I'm going to pass it over to Tim, and thank you all very much.
Thanks, Bill.
I couldn't. Now let's see if I can stop it. There we go. Okay, I did.
50-50 chance that I might not be able to figure this one out either. So let me see. So I should be able to see this. Can people see this? I don't think it's presenting yet.
We have your slide up. And
Fantastic.
there you go. Good job. I got it.
There you go. Showing up is half the battle, right? So thank you to all these fantastic previous speakers. I've met a few of you before, but it's always a pleasure, learning more and hearing kind of your thoughts on so many of these pieces. Thanks as well to Penny for the invitation and everyone as part of this series and support in getting us here. So I'm excited. I think I'm the last speaker, and then we'll go into Q&As. So in some ways, I'm going to kind of be very high level. I'm going to try to keep things from being too technical. I know that these slides are going to be shared later, so a little bit further on, I have more information on slides. So that's something that folks can refer to later. And yeah, overall, really kind of exploring kind of this role of healthcare kind of in policy, but also it really intersects a lot with the strategies that healthcare as a sector can take on climate action. So hopefully this ties in well with some of the things the other speakers had mentioned, in terms of what you can do potentially in a clinical setting, or within your individual health systems or future health systems around some of this stuff. So very briefly, because I always get this question, Healthcare Without Harm, I work for both Healthcare Without Harm and Practice Green Health. They're the same organization legally. Healthcare Without Harm, actually, we founded here in Boston originally. We really work, at this intersection of climate and health. Originally, really we're focused on environmental and toxics impacts on a global scale. We still work worldwide, nationally, and locally here as well. And our mission is kind of really centered around this idea of having healthcare become a community anchor for sustainability. Healthcare is oftentimes the largest employer. It's often a large landowner. It's often purchasing a lot of things, and I think with that and with this kind of central focus of doing no harm, that healthcare is uniquely has centered in its mission, provides an opportunity for leadership and almost a moral obligation for as well. And so healthcare without harm is really focused on, as I mentioned, that kind of intersection there. In Practice Green Health, we actually created, I don't know how long ago, I've only been here for 3 years, but before then, probably around 10, 15 years ago, to really serve as this membership kind of space for hospitals and health systems that are interested in taking action. I think essentially we received so many questions about like how to do this or what's my next step after, I'm interested, but what do I do now, that we really wanted to create a dedicated space for that. And I can talk more about that later and share some other resources. So I'm not going to go too into this because I think Dr. Butler and others have really done a much better job pointing this out than I have. But this is kind of dual piece to it, where healthcare is both contributing to our changing climate and also is threatened, by it. And I think beyond, I think climate change is increasingly recognized that it is increasingly recognized as a public health emergency, as an emergency just generally for the U.S. And obviously is having impacts on facilities, individuals' ability to get to and access healthcare, as well as those facilities themselves being able to open, being able to accept their staff, their health professionals, their frontline staff, their staff all the way throughout, in instances like extreme weather. And I won't go too much into this point here, but there's definitely, for example, very acute risks as it relates to flooding, even beyond sea level rise. And I think folks now here from Vermont and North Carolina examples understand that these threats are real, but they are actually very potential in this area. So if folks want to look into it more, I link these studies later in the presentation. But the other side of this as well, which is another factor, is that the healthcare sector itself is responsible for about 8.5% of our national greenhouse gas emissions. Most of that is coming from purchased goods, the things that are being used, that's actually the largest source of these emissions, as well as from the facilities themselves and facility-related energy. You can actually see here on the right, this is the MATEP plant. It's a combined heat and power plant. It uses natural gas to produce heat and steam and chilled water and other byproducts as well. And that's actually right in Longwood, next to a number of the facilities that folks may work at or work at in the future. And, we kind of have this interesting challenge because healthcare, has an obligation to try to address some of its emissions just more generally, but also really a central obligation to care for the community. And so those things have to kind of work in conjunction with each other. And, is one of the kind of considerations when we think about going forward. If we moved to renewables all of a sudden right now, and we weren't thoughtful about it, it could have an impact on, the resilience of the community. But at the same time, that movement is in some parts necessary and can actually benefit. For example, if you have your own microgrids, grids that are isolated from the larger grid and are being fueled by renewable energy, can save money, allow for additional resources to patients, and increase the resilience and reduce this threat. So those are kind of two pieces of that. I think broadly, this is a very kind of rough framework that I just put together with this slide deck, but really trying to tie in these different kind of levels of action. So you have obviously addressing the climate impacts themselves, whether it's healthcare's contribution to the broader changing climate.
I was like,
I just muted that person, sorry about that. But federal and local action, especially around policy, can address some of this work. And so then that's kind of a key feed in for some of those pieces. And federal and local action can be driven in part by health system action. Health system action, of course, can have its own impact on addressing kind of these broader climate impacts, but it can also be a model for actions that the federal, state, or local governments can take in order to kind of help expand on some of those actions themselves. And oftentimes health systems can be a very powerful voice in policy conversations. But ultimately, you come down to the level of analysis and action that we at Healthcare Without Harm are a testament to in the work that we do, where the individual action of clinicians, health professionals, nurses, physicians, everyone within a healthcare system can have, no matter how small it is, small consistent action has proven time and time again to be able to influence the health system, which in turn has been able to influence and expand on federal and local action and helps to contribute to addressing these broader climate impacts. So very kind of simplistic model, but I think gets to the point that individuals themselves and those who are here and your colleagues and other individuals in your current or future workspaces in healthcare can have a real impact in this. And so we'll start right at that top, federal and kind of state and local policy. You know, we've had some very landmark pieces of policy action at the federal and national level in the past few years. Folks may know the Inflation Reduction Act. That had a pretty significant piece related to investments in energy efficiency and clean energy technology. There's quite a bit of potential support for through tax breaks and kind of grants to hospitals and health systems that the IRA provides. Obviously, I'm not going to skip over the fact that I think the most recent election results are likely to change some aspects of this. At the same time, I think there are investments that are underway now that are there because of the IRA, and there are some aspects of the IRA, including some of the tax incentives that still may survive, even if the federal government in the future is less amenable to some of these pieces. I think similarly, we also had this HHS health sector pledge, which was put forward in the past few years. It represents just shy of 1,000 hospitals nationally that have committed to reducing their emissions publicly and producing kind of more detailed climate plans, not just on the impacts on their operations inside their four walls, but in the community as well. Locally in Boston, we have over 90% of Boston city hospitals on board, and about half of Massachusetts hospitals. And yes, although we expect some policy changes at the federal level, these hospitals have signed on. They've made a public commitment. I think we expect, as we did after the first Trump administration, that commitments like this will continue to be kind of focused on from media or other organizations, nonprofits, organizations like Healthcare Without Harm. And we fully expect to continue to work with and to some extent hold accountable some of the folks who have signed this pledge. But also, I mean, very likely either you're working at or you're at an organization that has either accessed IRA funds and are benefiting from some of those, or has signed this HHS pledge, which really form kind of a larger kind of indication or commitment to some of this action. Now, zooming a little bit, there's so much to go into this, and as a policy person, I could talk about this stuff for an hour, but that is not my mandate today. And I think it would go over your schedule penny. But in terms of local efforts, state and local government, I think has as folks may know, has a very kind of keen interest in addressing a lot of these impacts. Oftentimes, it's the impacts that the state and local governments are feeling kind of most acutely. So as a result, you see a lot of actions, for example, in Boston and in Massachusetts around heat action plans. This graphic's super familiar, I think, from Lindsay's presentation, who did a much better part of that, or Dr. Butler's presentation. You have air quality program, monitoring programs. You also have a lot more requirements at the local and state level for large building owners, including hospitals, to track their emissions, track their energy use, and then oftentimes start to reduce those. In Boston, there's a program called BERTO that's doing just that. And it's starting to require reductions, and that can have a significant impact in driving forward a lot of change within health systems. And you also have another kind of emerging area of opportunity around states, especially with the federal government kind of moving in the direction that we imagine it will under a Trump administration. State and local policy around this intersection of climate and health are going to be important areas for progress in this space. So, for example, Massachusetts Mass Health, the Medicaid program, will start requiring actually all acute care facilities to begin tracking next year and reporting to the state their own emissions. Kind of a first step, I think, especially for a Medicaid funded state entity or program, insurance program like that. You also have states like Oregon and a lot of others that offer some Medicaid recipients, it's very different in every state, access to things like AC units during heat emergencies. So very small example of the type of programs that states can help offer. And organizations like this New York State Insurance Fund, which is a workers' comp insurance plan, which provides workers' compensation insurance to hospitals in New York, offering up to $1 million to hospitals to just do some climate planning. So you have, I think, a lot of potential for these bigger issues around climate change to be addressed at the state and the local level, and obviously the momentum that has happened in the past around the federal level to continue. And so you look down next level of analysis and what healthcare itself can do. And these are broad categories. There's a lot of ways to kind of slice and dice these ones. This kind of came natural to me as I was putting this presentation together. But there's a few areas that healthcare and healthcare systems and hospitals can focus on, from proactively preparing for climate risks to partnering and empowering the community, especially related to preparing for climate risks, to reducing energy-related emissions, and even accelerating internal sustainability. And we'll go through kind of all of this, but we'll point out a few pieces that I think are worth noting. When it comes to kind of preparing for climate risks, hospitals and health systems can train professionals to kind of focus in on some of those health impacts. Can spend money through capital improvement plans and so forth around doing that as well. I think a key kind of piece that's often been overlooked, but I think is a key source of especially progress around community climate resilience and climate resilience ultimately for hospitals, is around empowering community more generally. Hospitals, as I mentioned, invest a lot of money into neighborhoods naturally because they're large landowners, they're employing a number of individuals, they're often hubs or located centrally, and also purchasing just a lot of money, whether it's food or other services from the community. Meanwhile, you have a lot of community-based organizations that are trying to advance pilots or think about different ways to address local climate resilience or their own carbon footprint or their own emissions profile inside their communities. For example, there's a group called Green Roots in Chelsea and East Boston that has stood up around 70 air quality monitoring stations. And so is there opportunities for hospitals, whether your hospital or others in a network, to invest more money into climate projects that are supported by the community? At the very least, I think the model for a lot of this kind of anchor institution work, as it's often characterized in the hospital settings, is to have some kind of co-ownership over how are these investment dollars being brought to the community, because the community often knows specifically the impacts that they're facing and can heavily inform the decision making around that. So at the very least, it should be a shared decision making process, but at the very least, bringing the community in for feedback and creating spaces for community members to be in community-based organizations to be part of that conversation is a key part of that. In terms of the renewable energy side of things as well, obviously, I think energy not used is a lot more sustainable than necessarily investing in renewable energy, although both of them play a role, I think, in trying to achieve some of those emissions reductions. But you see a lot of kind of innovative solutions that tie together some of these pieces. For example, in the top right here, this is actually a rooftop solar array that was built on one of the roofs for Boston Medical Center. And so they actually used IRA funds to put forward and build this system, and they're using the energy to provide to individuals who arrive in their emergency department who are displaying kind of instances of insecurity, especially around paying their bills or other similar challenges, and being able to kind of prescribe that through National Grid in this case to those individuals to offset some of the costs. So they're using this solar and offsetting patients who are vulnerable, who may not have the ability or struggle to pay some of their bills, to be able to kind of provide some of that energy and that offset there. So that's like, I think, a very kind of lodestar example of that. But there are many other examples, even if there's not an opportunity for on-site renewable, that you can join things like virtual power plants and many other options. I think as well, hospitals and health systems are very powerful voices when it comes to policy more generally. So, for example, Mass General Brigham is the largest employer in the state of Massachusetts. When that hospital or prominent leaders within the hospital to speak in support of climate policies at the state or local level, even if they're not directly related to something that's healthcare focused, it carries a lot of weight. And as practitioners, health professionals like nurses or physicians are actually some of the most trusted climate communicators in this space. So I think there's a kind of a unique role here for publicly supporting policies like that. And if you look at internal sustainability, which I kind of use as a catch-all here, institutions can commit themselves to achieving goals like net zero by 2050 or possibly more aggressive goals to reduce their emissions, which helps to set, at least a standard and a focus for this work going forward. Hiring or kind of elevating individuals to sustainability roles and empowering kind of employees across the org as well, and doing a number of other pieces as well. So this is just like each of these things could be and have been focuses for colleagues of mine elsewhere. And this is not an exhaustive list at all. But long and the short is that there's a lot of potential actions that hospital systems are, and should be taking to address both the emissions profile, the emissions that they're contributing to the changing climate, but as well as protecting their own communities and facilities from the impacts of climate. And I'll just want to touch kind of briefly, because I know I'm low-ish on time, things that individuals can do to drive that action at the system level, and ultimately that broader action more generally. And things that come to mind, advocacy kind of within your own hospital and workplace. There is countless examples that we have at Healthcare Without Harm of individuals coming to us saying, we're interested in doing something. What do we do? And taking and empowering and talking to their coworkers and other folks and driving forward action there. I mean, nurses and physicians, we found, are really key champions of sustainability initiatives, key advocates for policy, and ultimately are kind of the deciding factor in encouraging leadership to buy into their organizations to do a lot of this work. And so whether that's kind of leading on green teams or helping to identify changes that you could make possible in a practice setting, these are all actions that folks can take within your own workplace. I think beyond that, there's plenty of opportunities among colleagues or patients or in some instances with the community at large to talk about this intersection between climate and health, especially if it relates specifically to some of the work that you're doing. There's, as I'll mention as well, lots of tools and networks that you as professionals can use to make the case for climate and health action kind of more effectively. And I'll just emphasize it again, although it's somewhat redundant for the first point, is that I think your action, every action counts. I think everyone's here because they want to kind of, people are here for many different reasons, but ultimately patient care, patient outcomes are the primary goal. And climate interacts with that and impacts that in many different ways. And so you all are probably working or will be working in settings that are demanding, and that focusing on climate full-time is not on the cards. But even small, consistent actions by individuals or groups of individuals can drive momentum and drive larger systemic change. And I'll just quickly talk about one example where early on, Healthcare Without Harm worked with a group of nurses at Beth Israel Deaconess Medical Center. And those nurses were concerned because they suspected that these mercury thermometers that they were using every day were being thrown away and somehow contributing to the environmental impacts, especially asthma and other kind of pieces in children that they were then serving. And in fact, that was the case. These thermometers were being thrown into the landfill or thrown into a waste stream that then led to it being incinerated, causing a lot of impacts that then were being seen in a clinical setting. And so those nurses got together, they organized their own area, they organized their own hospital. Eventually the system itself switched from mercury to other just as well, if not better, thermometers. And then other systems did it. The city of Boston eventually, once it got to a point, Healthcare Without Harm or other organizations were supporting them, city of Boston eventually banned it. Then the state of Massachusetts, then nationally, and then most recently, internationally, there was a treaty signed to eliminate the use of mercury thermometers in healthcare. And so obviously those nurses weren't leading it the whole way, but they had the ability, and even with among a million other things that nurses do, and I come from a family of nurses, so I completely understand it. Y'all are driving forward change and somehow working 80 hours a week as well. They were able to kind of make that action and drive that forward. And so in terms of resources, I just want to shout out a few different groups. The Alliance for Nurses for Healthy Environments is a group that I think we're part of. We have some staff who are supporting it. They're a great organization with resources and provide a lot of internal, external advocacy opportunities for folks. Similarly, there's a physicians network that we work with as well, and those links are there. You can check those out later. A little bit of a plug here, Practice Green Health, again, is our membership organization. There is a payment aspect that, you know, hospitals pay at a system level. You actually might be at a hospital that has access to these resources, so I would check in internally or feel free to reach out if that's the case. And there's plenty of free resources as well, but there's a number of tools and also opportunities to connect with like-minded folks through cohorts and other aspects around specific things like that, those lists of opportunities that exist. And so, yeah, I mean, I at least just really want to emphasize that, especially your expertise, your voices are very essential in this larger conversation around how to address some of these climate and health impacts. And I think leading within your systems and collaborating with colleagues, either inside or outside, I think is what will help create the kind of resilient and equitable future I think we're all interested in seeing, and ultimately lead to healthier communities for all. So again, thank you so much for the opportunity to speak. And yeah, if you have any questions, feel free to connect.
Timothy, thank you very, very much. And that last example of nurses gathering together to make change in this whole climate crisis was just amazing and a great way to synthesize everything that we've talked about tonight. And I really appreciate it. And I am going to share my screen. I'm going to open it. Let me just see here. I'm going to have to take a second to do this. Ugh, I can't. Anyway, I can't get to my little slides, but that's all right. Let me see. Maybe I can. All right. And I can go to slideshow and from the current slide. And so here we are. I don't know if everyone can see it, but it's the question and answer period. And I have to say, I may have been too generous with the speakers this evening when I told them that when I submitted the program, it was 10 minutes short. And so they really took advantage of it. It was very hard to stop any of you because what you had to say was so powerful and so helpful in addressing the climate crisis. So it's time for anyone to include their questions, and you can type it in the chat or you can raise your hand, as I said. It's really up to you. So that's the first thing. And I'm going to take a look at the chat and see if we have anything there, because otherwise I came up with a number of questions. So let me see here. I know that, okay, we asked for resources. Oh, this was a good question, and I don't think we've answered it. It says, I'm curious, Bill mentioned a stat on mental health 12 years out from Katrina. 1 in 6 continue to show symptoms of PTSD. Are there studies on physical health effects years out? It seems this data would be helpful in providing help to current disaster victims. I don't know if Bill wants to address that or whether anyone else on the panel can address that. Nobody's jumping to it.
It's a good question. Yeah, I can pull the study to see if they also did. I think this was mostly a study on mental health, but certainly could do a follow-up to see if they had any physical health symptoms years out.
Yeah, I know that in the reading, some of the reading that I did for this panel, where I learned an incredible amount, was that the physical symptoms around individuals with cardiovascular disease or respiratory diseases have symptoms quite long term. I don't know if it's like 6 years out, 12 years out, but those two have physical consequences very long term. Let me take a look and see if there's any others, because I've got a few. I wanted to know with whether in all these health outcomes related to climate change and and the various disasters that occur, et cetera, is there any one health outcome that rises to the top and is the most important, or the most significant or the most prevalent? I know that when the committee met to develop this program, what came to our mind as being something that wasn't well addressed was the mental health. But I don't know if there's anything else that has risen to the top. Lindsay, you look
Yeah,
like you're
sure.
getting ready.
Sure, I can take that one, Penny. I think it's very difficult to say if one health outcome rises to the top because the outcomes are going to differ in different populations. So it depends. Like I would say for the elderly, I would be concerned about cardiovascular morbidity or mortality in extreme heat. For a younger person, like a child, I would be concerned about dehydration during extreme heat. For a pregnant person, I would be most concerned about preterm labor. So it really depends on the population. There's also geographic modifiers, right? You know, access to air conditioning.
Yeah.
I didn't mention this tonight, but extreme heat is a huge occupational hazard. So anyone who works outside, we're very concerned about. But if I had to choose sort of an effect of climate change that I'm most concerned about from a health perspective, as I think I mentioned, it's definitely extreme heat.
Okay, thank you. That helps, Lindsay. And this, let me just think here, because I sometimes I can't read my handwriting after I, write it in such a oh, you discussed, I could sort of see the relationship between the various climate changes and their relationship to different health outcomes, but I was having trouble with the heat as it relates to renal failure.
Sure. So, I'm not as well versed on the on the exact biological mechanisms. If I had to guess, I would say this is a link with extreme dehydration, and the electrolyte imbalance that would come with that.
That makes sense. Okay.
I also want to say too that there's a lot of medications that impact someone's ability to regulate their body temperature. So, say an elderly person who's spending time outside, who's taking some of those pharmaceuticals exposed to extreme heat, I would be really concerned about the impact of electrolyte imbalance and the impact on the kidneys.
That makes sense. We had another question here that I don't think anyone on the panel can really answer, but if Mary Scanlon is still here, I might ask her. She's on the faculty at Regis. Mary Beth, are you there?
I'm here.
I know. How much of this related to, climate change and the health outcomes and all of that, do we really address at the undergrad and grad level in nursing?
I can't speak to the grad level. It's been years since I've taught in that area. Undergrad, not as much as we should. I mean, that's my opinion. We do address it through health disparities, social disparities, and such, but and things to watch out for. But again, it's
in-
going to become more and more.
Yeah,
I would hope.
in the literature that I read, it really kept reiterating the need for addressing it in greater depth, both the effects of climate change on the health outcomes, as well as being prepared for the disasters that are increasing in frequency. And they did say that. So I would say that we probably are not doing enough. And if the individual who asked the question, go for it. That's one way you could advocate for change.
The other thing is Leslie, I think, is still here, who can address it from the public health perspective.
Is she?
She was. She may have left.
I can jump in as a undergraduate professor myself.
Oh, that's true.
I would say hard no to across the United States education system. Are we including this enough in the undergraduate curriculum? Not just because of climate change's impact on health, because of climate change's impact on everything. Climate change has massive implications for our economies, for our supply chains, for our food system, for our infrastructure and transit. I really strongly believe that no student should be leaving, especially an undergraduate liberal arts education, without knowledge of really what's happening to the planet, both in terms of the climate crisis and the biodiversity crisis, because no matter what these students go on to do, in some way, their career and their life is going to be impacted by the changing climate. So I think we're doing them a disservice if we're not preparing them with knowledge about what's happening to the climate, and how to enhance resiliency across the economy.
Thank you, Lindsay. And Timothy has said there are some efforts to incorporate this further, especially from AHNE members. And when at the end of this, in a couple of minutes, I will post a link for that particular organization. And Timothy's, you can tell he's from a family of nurses because he chose to make sure he included that in his presentation, which is really nice.
A lot of them, but also to Lindsay's point stands still. It's clearly not enough, and it's but it's yeah.
And then I can have one last question. So what are we doing? I mean, I have some sense, Dr. Sider, are we doing enough related to like the fossil fuels and all of that and how that contributes to the atmosphere and the climate change? I mean, are we doing enough? And
Yeah, that's an easy no. We're not even coming close to doing enough.
Okay.
We haven't even begun to slow down the rate of increase of greenhouse gas emissions. So it's we're and one of the goals set by the Paris Agreement a number of years ago was to try to keep the Earth's global temperature at no more than 1.5 degrees above pre-industrial times. We have hit that this year, so we're already at that point, and we're not slowing things down at all. So absolutely, we're not even remotely close to where we should be in order to try to limit warming to no more than 2 degrees, which is within the scientific community. There's a real sense that if we can keep the warming to be less than 2 degrees above pre-industrial times, and that is 2 degrees Celsius, we limit some of the most severe impacts. But it's going to be a lot for us to hit that goal now.
Okay. I am encouraged by what we can do as an individual. Yeah, we're not really going to take care of that CO2 thing, but we'll see what happens. I think we have time for this one last question from Ann Fryer. And this was for Dr. Sider. Oh boy, what is the impact on the new administration for the climate change impact on humans and patients?
Again, it's not good. I think the new administration, the kinds of appointments that have been floated for cabinet positions are not friendly to the climate change world. And much of the rhetoric that's come out of planning for that administration and its transition has been again not
great.
pushing us in a direction that we want it to go.
Right. And if I recall, in the very beginning of the chat, you did include a really nice statement about, it's not going to be easy and we just need to keep, moving on. So I think if attendees take a look at that statement, that would be important too, because that'll be up there a while. And at this point, I think I just want to really, really thank the panelists for a wonderful evening and very thought-provoking, a lot of information, and very well integrated. And like I said, the four of you worked together and it was really good. And the other I want to thank is I do want to thank Point 32 Health and Harvard Pilgrim Health, especially for their sponsorship of this panel series. For it's been at least 15 years. And without that sponsorship, we really couldn't be doing panels like this. So thank you very, very much. And our panelists are excused now from their evening duties, and I will post the link for the evaluation, etc.